And we begin this discussion. Now, the Special Investigating Unit says up to 2 billion rand was looted from Tembisa Hospital in Gauteng. That's more than double what was initially flagged by murdered whistleblower Babita Deokaran, who was killed in August of 2021. The SIU today releasing an interim report which names Hangwani Maumela and Vusumuzi Ketmatlala among those who allegedly benefited from the tenders at the facility. Let's take a listen for a moment.
Through the whistleblower and one of the many, and the main one that's known, it's Babita Deokaran, and may her soul rest in peace. At the time when we commenced, she had flagged suspicious activities of about 850 million. But when the investigation progressed, and as you can see, to date we are mentioning about 2 billion, so it has gone up almost twofold, if not threefold, and the investigation is still ongoing. So this staggering sum of money intended for the provision of health care at the Tembisa Hospital to take care of the most vulnerable was instead ruthlessly siphoned off through a complex web of fraud and corruption, representing an egregious betrayal of the public trust.
The SIU also revealing that syndicates allegedly used several front companies, 3 of them which are allegedly linked to Matlala.
We have uncovered a syndicate that's referred to as the Maumela Syndicate. And we are mentioning this surname Maumela simply because it has already been publicized. There has been an asset forfeiture order that was announced of Maumela Syndicate. So the Maumela Syndicate refers to the syndicate that is linked to Hangwani Morgan Maumela. The SIU is reviewing 1,728 bundles worth 816 million related to the Maumela Syndicate, and has completed to date 924 analyses, uncovering significant irregularities. So the SIU has traced about 41 suppliers or service providers linked to this Maumela Syndicate.
Well, staying with this story, the Health Minister, Dr. Aaron Motsoaledi, says if a dialogue is initiated on reinstating the death penalty in the country, he would support it, particularly for those who steal public funds.
We now have a national dialogue. We said we need to talk about these issues and reset. If we need to change certain parts of the Constitution, so let it be. And I said, as much as the death penalty might not be desirable, I said for 3 groups of people, I will definitely support it if the debate is put on the table. For those who rape and kill 3-month-old babies, infants who cannot even, it's worse than animals. For those who slaughter women in the manner in which you have heard, and for those who steal from the public in the manner in which these controls have done, in that case, I will definitely support it.
All right, let's get into the conversation now. Joining me for more on this alleged corruption and its impact on the poor who depend on such health facilities. We're joined by Bongani Banda. He is from Nursing Union Denosa. That's the person in the studio with me, the Gauteng chairperson of that union. And on the virtual platform, we're joined by Public Servants Association's Madimeja Mautla. And there you see the gentleman. We're also hoping to be joined by the Ahmed Kathrada Foundation's Nishan Bolton. I'm told that he has already joined. Good evening to all of my guests, and good to have you here. Let me start here in studio. Mr. Banda, good evening to you.
Good evening.
The understanding based on what the SIU has released today, is that a number of officials that are seen as low level at the hospital, and indeed, I suppose, within the Department of Health as well, they were the ones that were responsible for making sure that these approvals are indeed pushed through. They are the people today that are spoken of. So, as a union that organizes in the health space, would you say that there are any of your members that have been flagged for aiding and abetting the looting we're talking about today?
Thank you very much, Koli, and good evening to yourself and the viewers. And indeed, the question is quite clear. And I would say that, yes, indeed, there were members that were flagged, as you would have noted, that the officials who are called lower or junior are workers within Tembisa Hospital. And then as we are worker union leaders, we get to organize those that are working in the public sector and also both in the private. But we want also to indicate, to say that we believe that in as much as they are being flagged, we believe that there are numerous people that still needs to be flagged in this particular space. And most of them, it should be people from high rankings, it should be people from the director positions and within the department, because of, as you have heard the story of Babita. Babita was a person working within the Department of Health in the central office, but there's no one who's been flagged in that space. We are only focusing also on those that we call junior. And then Minister Motswale is even uploading to say that the junior are the ones that who are being flagged, and then he's quite happy because of they're the ones who are doing this work. But the reality is that there are people high who are actually doing these things. They are just the enablers on the ground.
Before I move on, how many then do you know of that have been flagged that are known to your union?
Currently, as they would have mentioned, that the 116 that was currently flagged, and then the ones that are undergoing the disciplinary actions, you to know that there are also nurses, and as Denosa is organizing nurses, specifically they mentioned an auxiliary nurse, which the question that we ask ourselves is that if you take an auxiliary nurse as somebody who's supposed to work in the clinical space, what was he doing in the process of procurement and supply chain? People of the area managers and the operational managers, there are people who are being flagged here simply because of they say that they signed for the machine that were not delivered. But the question it is that who then has to ensure that there's accountability specifically of the machines that gets to be delivered? Because of the CEOs, the director, deputy directors, and also the supply chain management are the ones who should be responsible to ensure that those things are being delivered in those hospitals. But flagging those who are in the units and saying that they've signed, it is something that is unfounded, which we believe that there are those that need to be put accountable, and they're not being mentioned in this report.
All right, we'll come back to that. Let's go to our virtual platform now, and let me introduce to the conversation Madimeja Mautla. Mr. Mautla, good evening to you. Let's start with what you had actually added your voice to regarding Tembisa Hospital. This was back in the year 2020, and at that time, an unfortunate incident, a terrible, in fact, tragedy had occurred. Shonisani Litole, this was a young man who died at that hospital, and he had been starved for 100 hours. He had been denied food over and above the negligence at the hospital. Looking at the matters today as they stand, where are things for you, and do you believe that indeed the SIU is on the right track in unearthing what they have called the most devastating plunder at that hospital?
Thank you, Koli, and good evening to the viewers. Yes, we commend the SIU for uncovering this whole thing for us. We have long, complained about the irregularities at Tembisa Hospital, which have gone beyond hand. And what we have seen over the years is that whenever the high-ranking officials are now faced with a challenge now to account to the public, they scapegoat the low-ranking officials. And indeed, I can confirm that even as with us as the PSA, we have officials who have been charged with misconduct over some irregularities in relation to supply chain activities. But when we look at the case by the employer, obviously we see a lot of cover-up. For them to show that they are doing something about corruption, they will target certain individuals who are not even close to decision-making positions, just so that they can show that they are doing something about corruption. When the actual fact is that the high-ranking officials are the culprits of all these financial irregularities and corruption, and colluding with businesses to exploit the workers of Tembisa and the community of Tembisa, who are not getting the actual services that they should be getting. And it's a concern for us that it's a painful thing that the working class of this country are exploited from all angles. They are exploited by unscrupulous businesses. They are exploited by the employer. They are also exploited through, these tendering processes. They are working under pressure, without resources, without people to relieve them. They are working overtime. They are overworked and underpaid. And these are some of the things that, as the PSA have raised previously, we also raised the...
All right. Mr. Mautla there, switching himself, unfortunately, and we'll try and see if he is reconnected. Let's bring into the conversation Nishan Bolton. Mr. Bolton, good evening to you. Thank you for making time for this conversation. With you, sir, can I start off the conversation with the acknowledgement of someone who basically started that press conference today, mentioned a number of times, Babita Deokaran. This is someone who sought to be an ethical public servant, but her life was cut short because someone must have whispered someone to those that were out to silence whistleblowers. Your words to her family on a day like this.
I think that we owe her a huge debt of gratitude. Were it not for the work that she started, we would not have gotten to the point that we were today, where the full, well, as far as this report goes, the extent of looting at Tembisa reaches the amount of just over 2 billion rand. Babita started that work, and that was acknowledged by Advocate Motibi. I think a family will take that as something that is worth celebrating. But until such time that the masterminds who paid the assassins are brought to book and are behind bars, there will never be closure for them and many others who have followed this case from day one. And that's the outstanding work that still needs to be done.
Yeah. You mentioned the ones who are the masterminds. There are two significant names that came out of that briefing today. There is a Mr. Hangwani Morgan Maumela, and that's the person that the Minister of Health mentions as driving around in Lamborghinis and all of these expensive cars. And then there is Vusimuzi Ket Matlala. That's another person who also enjoyed contracts from that hospital. Do you believe, in your heart of hearts, I know that we are speaking hypothetically right now, no one has been pointed to directly as the mastermind, but do you believe that this could be the masterminds?
It's hard to say, but certainly when you look at the amounts that they stood to lose from Babita's work becoming public, then this is a very strong possibility. When you read Jeff Swick's book as well, it does point to them as perhaps being the people who paid the assassins. But this would be speculative until such time that there is information that is probed, or when the people who are currently behind bars are persuaded somehow to reveal who exactly paid them and how that payments were done, which I think is still the work that the law enforcement agencies needed to have put in a bit more effort to have traced how these people got paid, where that money came from, and perhaps that would lead to identifying or unmasking the paymasters. But I think certainly based on who stood to lose the most from Babita's work, it does point to the people that are referred to in the report.
All right, we'll take a pause there, and when we return, you have heard the Public Servants Association and indeed the union that is in studio, Denosa. They are saying that junior employees are being scapegoated here. We're going to drill deeper into that and a whole lot more. Stay with us.
Babita Diokran, and may her soul rest in peace. At the time when we commenced, she had flagged suspicious activities of about 850 million.
These syndicates we have mentioned here, whether it's Maumela, whether it's Mazibuko, whether it's Ket Matala, whether it's X, even with their infinite wisdom or thuggery, they could not have achieved what they did without the cooperation and participation of government officials.
From this report, it is clear we need to broaden this investigation to other hospitals in the province.
So the Maumela syndicate refers to the syndicate that is linked to Hangwani Morgan Maumela. The SIU is reviewing 1,728 bundles worth 816 million related to the Maumela syndicate.
That all those that are working within our supply chain management, they must undergo lifestyle audits.
Watching this special of News at Prime, and we are discussing the plunder of the Tembisa Hospital. Who did what, and how are they going to be held responsible, but also, importantly, how the general public who rely on the public health facilities, how are they being dealt with badly at these facilities? My guests still, Bongani Banda in studio, and on the virtual platform we have Madimeja Mautla and Nishan Bolton. Let's come to you, Mr. Banda, and pick up on the element of junior staff being scapegoated. That's what you and PSA are arguing tonight. We are hearing that in total, there's about 41 suppliers or service providers that form part of this Maumela syndicate. Now, here's the interesting part. Both the winning bidders and those that would lose these contracts, it was found that they were actually part of one scheme. So they never really lost because they built these fictitious companies. Now, you hear the Premier of Gauteng, Panyaza Lesufi, saying that lifestyle audits must be conducted on staff that work in the supply chain. Again, I come to you, to the people that you represent. How senior do they go up in the rank? Do they sit in this supply chain management division?
Good. I think let's start here on the issue of the President, Ramaphosa, who came with the renewal, fighting corruption. Now, it is alleged that his nephew is the one that is being alleged in this particular matter, which is Maumela. But
now, let me quickly say something there.
Yeah.
Because he was asked this very question, you're quite right, the President, in Parliament, to say, there is your nephew here who is said to be looting at Tembisa Hospital. The President said, I don't know this gentleman. I've never met him. So I think just to put matters into perspective, that the President has responded to this particular question. That's what he says. But of course, those that investigate will be able to make the necessary links if indeed they are there.
Indeed, they will make those necessary links when the time comes and so on. But we have heard also with the Minister of Police who said he doesn't know Kathrada, but as it unfolds, we saw something else. But I want to come on this one, on this particular processes, that we hear now the Minister coming and saying that he will support what the China do of executing people who do the wrongdoing and so on. The reality of the matter, it is that the very same people with these corrupt activities are people who are found in those high offices, which starts from them, there by the Parliament and so on. If I want to come with that issue of Chinese and execution, it's going to start with them. It will never happen, that particular thing. We don't take the stance of the minister that come to say, as a PR, to come and try to show us as if like they want to do something about this. As he said when he was mentioning that when this report came to him, it was a wow. We don't want to take that particular aspect. And that's why we are saying that as much as this report is not flagging those who are in high-ranking offices, it becomes a problem for us because it only raises those who are junior officials who don't even sit in those processes of supply chain, of adjudication, and so on. So the reality in this particular issue that we are finding ourselves is, right now we are hearing the Premier saying that the supply chain management, they still need to undergo the lifestyle audit. Koli, when have you ever knew about this corruption? It's an issue that has been long-standing for quite some time. It doesn't start today. Why do you want to start today to say that people must undergo the lifestyle audit? It is something that has been there. We know it. But here we don't have people who have an appetite to implement the systems that will curb this corruption that is happening within the hospitals, within the healthcare facilities, simply because of they are also benefiting from the very same processes of supply chain and management in these institutions. And if it flags Kathrada, if it flags Maumela, we can only imagine who else in high-ranking officials does it flag? Because of those people, they can't come and talk to level 5s on the ground to come and assist them, enable them to be able to run their companies for such huge amount. There are people also who are benefiting, who are from the higher offices, or from the directors and going down. And the other thing it is that currently, the current MEC, it will be unfailing being against her if we're going to expect her to account for these issues. Norma Temba was the one who was in this particular office when we saw on the SIU report as it was skyrocketing during her era. The question is that why is she not appearing there? If Bandile Masuku was being axed in 2020 when there was 125 million of COVID contract, which was irregular. Now it's here. There was a skyrocket, there was increase of corruption, maladministration, malpractice, but there was nothing that was ever said. The report doesn't say anything about the MEC, which is Nomathemba Mokgweetli, who was the executive authority, the employer at that particular time. Equally, you can't expect level 5 and level 7s to be the one who are being taken care, who are being dealt with in this particular situation. Because of when they sign those RFQs, they go to deputy directors, which they go to the CEO, and they end up at the central office, which is where these documents are ending up as I is collecting those reports there. You think that all those people, they fail to see the irregularities, and we come and see them today when the SI report is mentioning them.
Yeah.
We don't believe that.
Mr. Mautla, let's come back to you from the Public Service Association. You have said that indeed you carry the same view as Mr. Banda here, that low-level staff are being scapegoated. Let me ask you the question then. The person whose name Mr. Banda is mentioning here, whom he says was a high-ranking official sitting in the health department at the time of this scandal, do you know the whereabouts of this person? And what about the CFO, who is understood to have been the person that Babita Deokaran confided in? The understanding is that that person was allowed to resign. What do you think needs to happen to these high-ranking officials?
Well, it all boils down to the political will from the highest level of government to deal with the rot. If that does not happen, scapegoating low-ranking officials is not going to stop corruption. If they get rid of one, they will also give this unlawful instructions to another person to execute and aid more corruption. So this thing, the high-ranking officials and the highest level of government, from the president to the premiers and the MECs, they've been aware of these issues. They have not done anything about it until a bomb exploded. And we demand accountability from the highest level, not down the level 6, level 5 employees who just carry out instructions from the high-ranking officials. I mean, if all these high-ranking officials do not know, they are just surprised as us, like us, we are surprised now about this exorbitant amount of money that is being, channeled to other companies, unscrupulous companies, through corrupt activities. Then it also means that they are either incompetent or they are complicit.
Mr. Bolton, let's bring you back into the conversation. You hear these statements that there is a lack of political will. I don't like using that because it really doesn't explain what the problem is. I had a conversation yesterday with the very journalist you mentioned earlier in your response, Jeff Wicks, and part of our conversation was, seated in that press conference are going to be these high-ranking officials, included among them the Premier of Gauteng alongside his MEC of Health. And indeed, they were there. And we said, in all probability, the Premier is going to talk tough against corruption. But the question is, what has been done about it? Today, you hear him saying lifestyle audits are going to be conducted. That's the problem that Mr. Banda here in studio has, to say corruption has been there in Tembisa for the longest time. What has been waiting? Why have these lifestyle audits waited for today for that announcement to be made? So let's do away with the euphemism of there's no political will. Tell us what the problem is with the leadership of this province.
Oh, are you going to give me hours for that kind of response? Just cast your mind back to 10, 15 years ago. The MEC of Health, Branch Longer, was implicated in a huge, huge corruption scandal. That has dragged on up until now. There's been very little action, although there was some legal processes, I think early last year or early this year. But that's how long these things have taken. And the kinds of scale of corruption that you see in Tembisa probably started in the department in the first instance and laid the kinds of models and groundwork for further application in Tembisa. So I think the Premier is right. They need to do all that he is saying. But my colleagues, they are absolutely correct. This should have started much earlier because the problem didn't start with Tembisa. It started 15, 20 years ago. And these remedial measures should have been put in place a long time ago. So there's nothing new that they're saying. We are also of the view that simple things in terms of just making procurement information transparent and available. Make all tender information, whoever has been given tenders, irrespective of 500,000 or below or up, should be made publicly available. That will enable academics, investigative journalists, and everybody else to develop the systems to keep sight of all of this. It helped during the early stages of COVID, when that was the case, but was put to an abrupt end. And then the excuse was that it trampled on people's personal information. And I think that we have a very different view about that.
Yeah.
Political will, I agree with you, is much too broad. What is really required is for people to do the job that they were elected to do, for which they are paid to do, is to ensure that there is absolutely prudent use of public resources. And when that is not done, the heads must roll, which is really the last point. Is that it is fine to talk about lower level officials. And again, I agree with my colleagues there. I made the very same point at the press conference today, that the people listed in the extended report that you will find online are lower level officials. But there's no way that what they were engaged in was not signed off. The paperwork that they had submitted was not signed off right to the top. The public service doesn't work like that.
Yeah.
So therefore, people deliberately turned a blind eye, and now it's those at the bottom who are going to have to carry the can.
Let me come back here in studio, Mr. Banda.
So,
In the keeping with the theme of accountability, or people needing to do what they were either elected to do or are paid to do in the case of civil servants. The SIU today says, this is Advocate Andy Motibi's words to the NPA, and I quote, "The NPA now holds the evidence needed to pursue criminal charges against those who facilitated the embezzlement of these public funds." That's it's instructive, that tone from Andy Motibi. And I suspect the reason he said that, I'm speculating now, the reason he said that is that when the SIU investigates and sends or refers matters to the NPA will always tell us that the SIU, yes, they may have investigated, but they do not give us court-ready documents or court-ready evidence. We have to do further investigations. Today, he says it, he puts it differently. The NPA now holds the evidence needed to pursue criminal charges against those who facilitated the embezzlement of these funds. What do you expect of the NPA right now?
yeah, no, I think quite clearly, as we know, that the SIU will deal with much civil issues, and the NPA then will deal with criminal processes in this particular matter. And would like to say that we actually are comforted by such a statement. And I will tell you something, that in as much as we are the labor representative, we will never promote any wrongdoing in the healthcare sector, specifically that compromises our workers and also compromises the patient care or service delivery. And whatever that the SIU is saying, specifically to the NPA, we believe that NPA then must start taking action. Thugs must then face the might of law, and they must be taken to task until these issues get to be addressed as supposed to.
You're probably sitting there thinking, I'm going to let you go scot-free on some of the points you've made. You've made some good points, and indeed, you come across as standing against corruption. But you're part of the same ANC-led alliance. By virtue of the union you belong to, it falls under COSATU. COSATU is part of the governing alliance with the ANC. So a person sitting at home is saying, why should we believe this gentleman? Why must we take you at your word when you cry here and say there's no political will to do things? You sit with these people at these high-level meetings. What comes out of those meetings?
Thanks, Cody, for that question. And then I'll tell you, I expected that question, because the question that you go around perpetuating to say that because of we are aligned, we can't hold each other accountable. In the space that you are working in currently, it is that we are worker-led a movement which is mandated by its own members. And then what we represent the mandate of our members. In this instance, you can go back and go check Denosa on issues that have been raising against the Tembisa Hospital, and which we're still continuing raising because of those who are in governance dissociate themselves from specifically saying that it's ANC and COSATU. They're in governance. Yeah. Expectation, it is that they must then execute the duties that are expected from them as public servants, and it will hold them accountable without being apologetic about that particular issue. And we've been doing that quite comfortably and then with success. We have never failed on that one. That's why even today, I'm standing strong against the corruption, because of even the president of the ANC, when he came, he says he's going to fight the corruption. And if he fails to fight that, we'll fight him.
Mr. Mautla, very quickly before we end the conversation, at the Madlanga Commission today, we have heard exactly one of the names that are mentioned in Tembisa, Vusumuzi Matlala. He is also mentioned here in the Tembisa matter. And what the evidence was led there today tells us is that monies would flow from him to intermediaries. Those intermediaries are people that either handle the Minister of Police in order for monies to flow directly into the ANC. So I asked the Minister of Health, your organization, your political organization, is once again implicated. What should people make of these statements? These are not empty statements. The president of the ANC has long told us that the ANC is accused number one when it comes to corruption.
Well, currently we have a government of national unity, so it will be unfair to pinpoint a specific political party. And I'm not coming to their defense. But what I want to say is that this government is not being fair to the citizens of this country, especially in terms of dealing decisively with corruption and outrooting malfeasance in the public service, and ensuring that all the monies that have been allocated to service the people actually do what is meant to be done with that money. So you know, the workers of this country cannot even afford medical aid. We want to see a situation where everybody who's sick has confidence in visiting a public hospital. That is not happening in this country. The public servants and all the workers in the country are paying exorbitant money in terms of tax. They are paying a lot of money in tax.
Yeah.
And they are still forced to pay medical aid, which they cannot even afford.
Mr.
So
Mautla,
this government...
I apologize. I apologize for cutting you off. I have to also give a chance to Nishan quickly before we end. And Nishan, please be quick as well. The Minister of Health says he would support the introduction of a death penalty to try and end corruption. Is that even possible? You muted?
No, I was at the conference. That's not exactly what he said.
No, he clarified it here. He clarified on the station.
Okay, no, well, I wasn't at that clarification. No, you can't have the death penalty in this country unless the constitution is amended. And I think that is a completely separate process. In any event, the systemic issues within health need to be addressed first and foremost. And those systemic issues, I think, have been unearthed by this report and by many others.
All right.
And that's what has to be fixed.
Thank you very much to all of my guests. I cannot mention all of you by name, but thank you very much for making contributions to such an important discussion. And that's where we're going to end it tonight. We are running over time, so I'll see you tomorrow. Thank you for watching.